Today we'll be learning about local anesthesia complications. Disclaimer: the given information may not be verified exhaustively by experts. Now, complications are mostly rare. List is exhaustive, not to frighten you, but necessary for informed consent. Most of the complications are manageable, and rarely it may lead you to a lifetime of debilitations. The doctor must be informed whenever a patient experiences any of these complications. There are basically two types of complications, local and systemic. Please note that the cost of management of complications, if any, is not covered in the treatment charges. Minor complications, though, may not be charged. Early neurological symptoms, the chances for which are minimal, are as follows. Number 1, numbness around the mouth and tongue region. Number 2, metallic taste. Number 3, lightheadedness. Number 4, dizziness. Number 5, visual and auditory, which is hearing disturbances. Difficulty focusing and tinnitus. Tinnitus is basically ringing sensation in the ear. Disorientation, drowsiness. Now, severe respiratory and cardiovascular symptoms are as follows: hypotension, irregular heartbeat, rapid breathing, slow heart rate, cardiac arrest, respiratory arrest, and death. Now, local complications are as follows, the chances for which are minimal. Number 1, pain during injection. Number 2, needle breakage. Frequency is greatly reduced since stainless steel needles are used. Number 3 is prolonged anesthesia. It usually reverts to normal without treatment. Number 4 is spasm of the jaw muscles or lockjaw. Number 5 is soft tissue injury. Number 5 is hematoma, which is collection of blood outside blood vessels. Now, as a rule, if after needle insertion hematomas occur, they usually resorb over time with no residual effect other than discoloration that goes away in few days' time. Number 6 is pain during injection. Number 7 is infection. Number 8 is edema, which is collection of fluid in body tissues. Number 9 is post-anesthetic intraoral lesions, which is lesions within the mouth. Number 10 is damage to adjacent hard and soft structures. Number 11 is TMJD, which is temporomandibular joint disorder. Now, it can happen in all dental procedures. If it happens, it can cause varying problems. The list of complications due to TMJ is very exhaustive, and patient is encouraged to go through the list which is available. Systemic complications have minimal chances. Number 1, toxicity. Anesthesia not metabolized due to systemic diseases. Number 2 is allergy. Swelling or angioedema, which is rapid swelling on area beneath the skin due to fluid accumulation. Now, types of allergic reactions of local anesthesia are as follows. Number 1 is immediate hypersensitivity reaction. Symptoms include pruritus, which is itchy, urticaria, which are hives or skin rashes, bronchospasm, which is difficulty in breathing, angioedema, which is swelling under the skin, anaphylaxis, which will be explained later. It usually happens within 1 hour. Number 2 is contact dermatitis and delayed hypersensitivity. Now, allergic dermatitis is irritation of the skin and delayed swelling at the site of administration. This happens within 72 hours and they can be life-threatening. Anaphylaxis. So, local anesthetics are common to cause adverse reactions, and clinical symptoms often correspond to anaphylaxis with tachycardia or hypotension. So, tachycardia is increased heart rate and hypotension is low blood pressure, and subjective feelings of weakness, heat or vertigo. Vertigo is basically spinning sensation. Anaphylaxis is a serious life-threatening allergic reaction, and certain people are more at risk of anaphylaxis. If you have allergies or asthma and have a family history of anaphylaxis, your risks is higher. And if you have experienced anaphylaxis, your risk of having another anaphylactic reaction is increased. Warning signs typically affect more than one part of the body and may include the following: red rash with hives or welts that is usually itchy. So it is possible to have a severe allergic reaction without skin symptoms. Swollen throat or swollen areas of the body, it is possible to have a severe allergic reaction without skin symptoms also. Wheezing, passing out, chest tightness, trouble breathing, cough, all of these can also happen. Hoarse voice, trouble swallowing, vomiting, stomach cramping, pale or red color to the face and body, and feeling of impending doom. Coming on to accidental swallowing of foreign bodies. Specialists have determined that if swallowed accidentally, 87% of foreign bodies entered the alimentary canal, which is food pipe, whereas 13% was aspirated into the respiratory tract, which is air pipe and lungs. Now, literature also showed that although 90% of ingested foreign objects could pass through the stomach uneventfully, there are roughly 10% chances that it requires endoscopic removal. In this procedure, an instrument is introduced into the body to give a view of its internal parts, while still 1% will ever require operation. Now, accidental swallowing can cause some serious complications and can eventually even lead to death, particularly if it goes into the air pipe. Patients with pregnancy, obesity, sliding hiatal hernia are also at greater risk of aspiration or ingestion of foreign objects. Immediately inform the doctor in case of accidental ingestion of foreign bodies. Misdiagnosis during procedure and anatomic variation can always show misjudgment and may happen at the hands of an experienced dentist. Although this is an exhaustive list of complications, a complete list is impossible to make. Also, there may be certain complications waiting to happen which are not yet listed in the literature. If you have any further questions, please write back to us by mail. Thank you.